Hello viewers, I welcome you all to the interactive session. I am Dr. Dayanand, DNB trainee, Department of Nephrology, Narayana Health City, Bangalore. I welcome one of the senior consultant nephrologist and transplant physician, Dr. Ishtiaque Ahmed, Department of Nephrology, Narayana Health City, Bangalore. Sir, I want to know who are the people at risk for chronic kidney disease?
The commonest risk factors are person with diabetes, person with hypertension, a person who takes regular painkillers, the tendency is slight body pain, some headache, tendency to take a lot of painkillers. A person with a family history of a chronic kidney disease, brother has or mother has kidney disease in the family. Plus, any individual after the age of 60, as age advances, there is a higher risk of developing chronic kidney disease.
For diagnosing or detecting chronic kidney disease, who are the people in whom we need to screen them regularly for detecting the CKD?
So once again, same group of persons, like person who has a diabetes, absolutely no symptoms. Even then, it is better to go for a screening for kidney disease at least once a year. Person who has hypertension for a long time, better go for a screening once a year. Person with a family history of kidney disease, once again I will say better to go for a kidney disease screening. A person who is very obese, morbid obesity, is also one of the indication to go for a regular screening. So these are the few common group of persons who will require regular screening for chronic kidney disease.
Okay. So what are the precautionary measures to prevent chronic kidney disease, or is there any indication or any restriction for fluid intake or water intake in patients with chronic kidney disease?
Yeah, precautions basically will depend on the background of person. If person is diabetic, then he should monitor his sugar regularly, make sure that blood sugar is well controlled over a period of time. If sugars are not well controlled, then the risk of developing kidney disease is very high. So if a person is a diabetic, make sure that his sugars are well controlled. If person is hypertensive, make sure that his blood pressure is monitored regularly and it is kept under good control. If person is obese, he should make sure that he loses his weight. If person takes smoke, he is a habitual heavy smoker, then he has to stop his smoking, because smoking also causes kidney damage. It's not only that smoking causes damage in the lung, smoking directly can cause damage in the kidneys also. So basically precautions will depend on what is the background of the person. A diabetic person, hypertensive person, obese person, or a person has a tendency to take a lot of painkillers. Make sure that you don't take painkillers, and if painkillers are really required, then you should go for kidney friendly painkillers, not to go for other painkillers. Regarding water intake, normal person should take about about 40 ml per kg. Just to give example, if person is about 60 kg, so he has to take 60 into 40, that is about 2400 ml. If person is about 80 kg, then 80 into 40, that is about 3200 ml. So water intake will depend on the body weight in the adult person. So in short, it is body weight in kgs into 40. That should be the water fluid intake per day.
So what are the common drugs which can affect kidneys?
There are many drugs which can cause kidney damage, but if you take the commonest drugs which causes kidney damage is painkillers. The painkillers like Brufen, Combiflam, Diclofenac, Nimesulide, they commonly used painkillers. These are the commonest cause of drug-related kidney damage. So in addition to painkillers, there are a lot of antibiotics which can cause kidney damage, like aminoglycosides and Septron. There are many drugs, many antibiotics. The drug-related kidney damage can be dose dependent. That means more you take, more risk of developing kidney damage. Sometimes it can be dose independent. That means even a single dose of drug can cause significant kidney damage. So you should remember, it can be dose dependent. That means higher the dosage, higher the risk of developing kidney damage, or it can be dose independent. That means it can be a kidney damage with a single dose of nephrotoxic drug.
Okay, as you told, many drugs can affect kidneys. Are there any drugs which are safe for kidneys?
There are very few painkillers which are safe for the kidney. The commonest drug what we use is paracetamol. It is good for mild to moderate pains, and it is kidney friendly. But it may not be a very good painkiller for severe pain. For mild to moderate pain, we can go for a paracetamol. If pain is very severe, there are few drugs like tramadol or proxivon or pethidine. So in generally, paracetamol is safe for mild to moderate pain, but if pain is very severe, then we have to go for tramadol, or we call centrally acting drugs like opioid analgesics.
Is the smoking risk factor for kidneys?
Yes, smoking is also a risk factor for the kidney disease. A lot of us, we think that smoking is dangerous only for the lungs and for the heart. But if you see, smoking is very bad for the kidney also. Smoking itself directly can cause damage to the kidney. So smoking is not good for the kidneys also. Take care. Thank you.